Hello everyone, welcome to this month's webinar. We have Professor Robin Lucas presenting on the title, Welcome to the 2018 Advanced Training Program in Public Health Medicine. I'll now hand it over to Professor Robin Lucas.
Hi everybody, thanks for coming to this webinar, which was really just an overview of the Advanced Training Program in Public Health Medicine in 2018. This was originally going to be Tony Gill, who's the chair of the Faculty Training Committee, and me as chair of the Faculty Education Committee, but Tony's had to pull out, so you have to put up with me for the whole thing. Some of the detail of training that Tony has, I might not have, but if you've got questions that I can't answer, then I'll take those through to Tony. So I'm just going to run through the training program. It's very much as it is in the handbook, and I'll get onto those, but do please feel free to ask questions and I'll do my best to answer those. So what we're going to look at is an overview of the training program. I'm going to briefly talk to you about learning contracts and learning contract reports, and then about the timetable and assessments. These people you probably know, important people in the office for training, is Leah Iliu, and you can get her on that email address. These slides will be available to you so that you'll have them as a resource. Assessment, contact Leah in the first instance, and then examinations at the admin person at the moment is Caroline, who's really good at, knows everything there is about our public health exams. So if you've got questions, Caroline's the first port of call about that. I think this is really important. The training program is adult learning, so you're responsible for your training. It's up to you to organise your supervisors to sign off on things. It's up to you to get things into supervisors in a reasonable time frame so that they have the opportunity to sign off on things. It's up to you to understand what the requirements of the training program are, what the due dates are, what the criteria are for learning workplace reports and things like that. So you're responsible for your training. So when I was chair of the assessment subcommittee, almost every workplace report submission time I would get a trainee that says, oh, I didn't realise what the due date was. Can I submit it instead of Friday night at 5 o'clock or midnight or whenever it finished? Can I submit it on Monday morning? So that sort of thing's not acceptable. You need to take responsibility for keeping track of the things that need to be covered in the learning. And we're here to help, but we can't possibly sort of manage all of the trainees. You have to seek help if you don't understand something or if you need something. So you'll know this from our training curriculum. So that's this document here, which I find really useful to have hard copy of in terms of looking at the competencies and fulfilling in learning contracts and so forth. It's on the web, so easy enough for you to get. So we cover these 6 broad areas: general professional practice, cultural competency, information, research and evaluation, policy, health promotion and disease prevention, and health sector advocacy, development and management. And you'll know if you look at the curriculum document, you'll see that under each of those there are a number of sub areas, and you're required to get competency at some level in each of those sub areas over the course of training. So training requirements, it's 36 units of training, which is sort of like full-time equivalent months, so essentially 3 years. The training curriculum I just talked to you about, and that's the link for it there. And there's also the general training for the college professional qualities curriculum, which is also on the website. If you just search the college website, you'll find it there. For each period of training, you're required to have a supervisor who's a fellow of the faculty. And if your workplace supervisor is not a fellow, then you have to have a fellow who's a co-supervisor. And that's to ensure that the training that you're getting and the work that you're producing is appropriate for training in the Faculty of Public Health Medicine. You need to have a mentor who is a fellow of the faculty, typically. Very occasionally, we have been approached by trainees who want a mentor who's not a fellow, and that's something that has to come for discussion at the Faculty Education Committee. But typically, the mentor, and I'll talk a little bit more about the mentor later, but typically the mentor is someone to help guide your training through the training program. It may be, you may have many mentors that are helping you with many other parts of your life, but the mentor that we have for the faculty is to guide you through the training program. So it's important that that person has an understanding, not just of public health, but of our public health training program. Here's the document about the handbook that's got, you need to be familiar with the current handbook in advanced training. So this comes out now every 2 years, and it's important that when the new handbook comes out, whatever's in that handbook as requirements pertain to you from the year that that handbook comes out. So the 2019 requirements will be requirements for any trainee who was still in the program in 2019. Doesn't matter when they started, how long they've been going. If you're in the program in 2019, the 2019 handbook requirements apply to you, and you'll see why that's relevant when we get up to the research projects. But for 2018, we're still using the 2017-2018 handbook, and requirements, as you can see here. So every year you have to have at least one learning contract, and if you have multiple positions within the year, then you'll have multiple learning contracts, one for each of those positions. We recommend that you come to National Training Day, and that's not compulsory. And Tony Gill, the chair of the training committee, asked me to let you know that the 2018 training day, National Training Day, is still under a bit of discussion in terms of trying to find a venue which makes it not too expensive for trainees to attend. So that's something I can't tell you a lot about at this stage. It's a work in progress, and Tony will let you know more as we know more. And then the faculty puts on 8 to 10 video conferences for trainees over the course of the year, and again, they're not compulsory, but they should be useful training and an opportunity to ask questions of the training program. So entry requirements, this is probably not so relevant for you because all of the trainees are already in the training program, but just to remember, you must have a Masters of Public Health degree that satisfies these compulsory core discipline areas. In 2019, you actually will have to have had people coming into the training program will have had to have had actually completed all of those compulsory core discipline areas. But up until now, you can get in to the training program and then complete some of those core discipline areas over the first year of training. Now, you will not be able to progress beyond the first year of training, so beyond the first 12 units of training, until any additional training to cover those core areas has been completed. So if you're in your first year and you've been identified as having to make up some additional courses within those core discipline areas, you won't be able to go into the second year of training until you've completed those core areas. And then the other things, general medical registration, that has to be maintained across training, at least 3 years of postgraduate medical experience, and appointment to an approved public health training position. So we talked about this. We give you the training program. We'll give you experience in public health medicine, and it's up to you to organise your training positions to ensure that you cover the breadth of the curriculum. 36 units of certified training, and you have to cover off the learning objectives outlined in the curriculum. You might think that, and it may be that within the rotations that you're able to secure, it's difficult to cover off some of those competencies. So you have to work with your mentor and your supervisors to look at what you can logically cover in your formal rotations, and then think about how you might be able to cover some of the other competencies that you're required to cover, but you might not be able to get them just through your general work. So that might be through secondments to other locations. We've had a STP trainee here at in Canberra at the National Centre for Epidemiology and Population Health, who actually spent most of the year at Hunter New England Health getting the experience that you need from a public health unit. So you have to look for opportunities. Sometimes it might be reading or courses, but it's good to identify right at the beginning of the training, look at the competencies that are required, look at the curriculum, and think about how you're going to be able to best cover off on those things. So we do allow up to 12 units of training overseas. This has to be approved prospectively, so you can't get into that overseas training position and then say, can I train here? You can't finish it and then say, can I count that, except through recognition of prior learning. So you need to, if you want to go and do 12 months overseas, then you need to actually apply for that prospectively and have it approved by the Faculty Training Committee. You also need to, you need to do a bit of homework before you do this. The position has to be accredited for training with the faculty. So that means that for your training to be counted, it has to be in an accredited training position. So if you start at the overseas-based position and it's not accredited, then your training won't be counted until it is actually accredited. So this has to be set up in advance. So 12 months overseas, but the other 2 years have to be completed in Australia or New Zealand. And you can do that 12 months at any time. We used to have a rule that your first 12 months had to be in Australia, but we no longer have that. You can do the 12 months overseas. You can do the first year overseas if you want to do it overseas, but 24 units has to be completed in Australia or New Zealand. You can have up to a maximum of 12 months of a PhD that can count towards your training. But you'll see the bottom dot point there. You can't have 12 months overseas doing a PhD and 12 months overseas doing something else. If you're 12 months overseas is 12 months overseas, whether it's working in a public health unit or something or doing a PhD, they're not, you can't count them as two separate years, they're the same thing. And again, if you want to count credit for a PhD study, it has to be approved prospectively. So make sure you think about this when you're going into a PhD. If you want to include this, get it checked off with the Faculty Training Committee first. I talked briefly about mentors, so a minimum of one mentor over the course of the training. So you might have multiple mentors, but we found it works well if you try to have the same mentor who takes you right through the whole training program. That can, of course, fall apart for a whole range of reasons, but that's the recommendation. So the mentor, as I've said, must be a fellow, and they give you this guidance. They're separate, they're different to a supervisor. We're going to get some documentation about mentoring up on the faculty website. over the next few weeks, but it's somebody separate from a supervisor, that's somebody for you to chat to sort of outside of your actual working environment. So in terms of supervisors, I've already said this, at least one supervisor who's a fellow of the faculty for each training position. And the idea is that that supervisor supports trainees in planning and facilitating the learning path, really looks for teaching and learning opportunities. It's also up to you to be thinking really carefully about what teaching and learning opportunities, are there opportunities to do a DOPS or an oral presentation? You need to be looking for those as well as the supervisor. Don't just rely on the supervisors. They're busy, they might have multiple trainees. You need to also be looking for those things. It's really important that you give the supervisor time to give good feedback on your progress and any of the things that you're submitting for assessment, like workplace reports. So the supervisor is a good person to run that workplace report by, to check that it's okay, to give you critical feedback, to increase the chances that when you submit it, it will be a pass first time round and won't need to be resubmitted. And of course, the supervisor and the mentor have to sign off on the learning contract and the learning contract report. So that's important that they're in the loop with all of those things. So learning contracts. The idea of the learning contract, it is a contract. It's an agreement between the trainee and the supervisor, an agreed set of things that will be achieved during that position. It has to be submitted within 4 weeks of commencing a position. So please keep that number in mind, so that it really sort of sets out what you plan to do over that period of training. So at least one per 12-month period, and more if you're in different training positions. And if you haven't seen one, have a look at the learning contract template, but it includes a description of the different activities, projects and professional roles that you'll have while you're in that position. You have to link each of those things that you're going to do, the activities, to the competency. So this is where I think it's really useful to have a hard copy of the curriculum, so that you can really easily see what competencies can be achieved during that training period or during that training position. This is, it's the training committee that has a look at this, and this is obviously some of the common problems that Tony Gill and the training committee see. Don't just cut and paste competency lists. Really think about what competencies you can cover with whatever activities and projects you're doing. Don't just write the numbers, because that's not really very helpful to the training committee. It means that they have to go back to the curriculum all the time to see whether what you're saying you can cover off does actually seem reasonable. Competencies are linked to the specific activities or projects, so they need to be consistent across those. We need to see that, yes, it is likely that you can get the competencies that you say you're going to cover with that particular activity, and make sure you describe your role in the project. So then the learning contract report is where so the learning contract says, this is what we're planning to do, and you submit it right at the beginning of that training rotation. And then the learning contract report says, this is what I actually did, because things might change, something might come up, an outbreak or an environmental risk assessment or so forth, that you hadn't planned on doing, but it's come up and so you do it. So in the learning contract report, you're reporting on what you actually did over that period of training. It's due within 6 weeks of completing the position, and the mentor has to sign off on it. So as I say, it summarises all the activities and projects you actually did. it details the outcomes of all of those and how they link to the learning objectives. So what competencies you actually did achieve over that period of training in that position. And if you make changes to your learning contract regarding how much time, your full-time equivalent, then you need to submit an amended learning contract. So for example, if you said you were going to be working full-time in your learning contract, but then you drop down to half-time, then you need to actually let the training committee know that you've made that change to your training. So still on the learning contract report, so it talks about you have to report on the roles that you actually took, the outputs from those projects, any training and conferences, and a reflection on your training period. So it really is a summary of what you've actually done and achieved during that time. And you should try to keep some sort of evidence of all of the things that you've done. So pieces of writing that you've done within those positions, the brochures or the conference handbook of the conferences that you've been to, things like that. So this is one that I got caught up with one of my trainees. Once you've achieved the required level of competence that's in the curriculum, so either a 1 or a 2, you don't have to then keep putting that in subsequent learning contracts. So if you've achieved something in the very first learning contract, you don't need to keep saying in subsequent learning contracts, I'm going to achieve that one, I'm going to achieve that one. Once you've achieved it, you've achieved it, and you don't keep having to demonstrate that you're going to be able to achieve that. So Belinda just asked me, did I say the venue for the National Training Days is not yet finalised? And yes, that's what I did say. And Tony just phoned me about that this morning. And so he will be in touch about that venue. So you'll have to just wait for that a little bit. I think we've covered that. If you change projects, then you outline the learning contract report reports on what you actually did is the key thing, and is signed off by both the supervisor and mentor. So just to reiterate on these important things, learning contracts are due within 4 weeks of commencing a position. Learning contract reports are due within 6 weeks of completing a position. I think the application to commence training is not so important for you guys because presumably you've already commenced training. And similarly, the application to commence training, once you receive eligibility, you actually have to apply to commence training. Otherwise, you have to have assessment of eligibility again if you don't do it within 12 months. That probably isn't that relevant to you because presumably you're all in training. And then this is just a list of some of the education policies. These are all on the college website. They're worth a little bit of a look, and it's useful to know that they're there. If you need the bottom line on any of these things, you don't understand about accreditation of training settings, or you think you might want to apply for recognition of prior learning, all of those policies are up on the college website. If you have any trouble finding them, I'm sure Leah can help you find them. They do have things like recognition of prior learning. I think you need to apply within 3 months of starting the training program. So it's up to you, again, as adult learners, to be aware of what's required of those things. So, if you think any of them might apply to you, it's worth having a bit of a scan of them to just to know whether you might have to apply at, within a period of time. So that's the training bit, and the next bit is around assessments. Do you have any questions about any of that training stuff? So Belinda's asking, regarding the learning contract, if a new project, for example, a brief secondment to another area, comes up after the 4-week cutoff, is it better to do an amended learning contract or just put the details on the learning contract report at the end? I would just put it on the learning contract report at the end. This will happen all the time, you know, because you don't know you just don't know what's going to come up. So you plan what you're going to do and what competencies that you're going to cover. But if another project comes up and you do something quite different, then just keep a note of that and put it in the learning contract report. You could think of the learning contract report as a bit of a living document. So start to fill it in as you've done the learning contract, and then add things to it as they come up. All right, I'll go on if I can get the mouse to behave itself. All right, on to assessment. So the assessment scheme is very much linked to the competencies that are in the curriculum. And we have both formative and summative assessments, and I'll explain what the difference between those is in a minute. The emphasis is on ongoing workplace-based assessment. So it really is a focus on this, on what you're learning and using assessment within the workplace. We've tried to reduce the emphasis on the end of training assessment, things like we used to have, you produced a single bound volume at the end of training and then sat the exam. We do still have the exam, which is obviously an end of training assessment. And it's difficult to see how to get past that exam, although we are continually reassessing the format of the exam or whether we need the exam and all of those things. But for the moment, we have the exam. And our assessments have to be aligned with what's happening within the college itself. So some years ago, when the college brought in the direct observation of procedural skills, we brought in the direct observation of practical professional skills as a sort of a semi-equivalent type assessment. So we sort of have to track with what the college is doing. And there's a big review of assessments coming up within the college. So, you know, things are being worked on by the assessment subcommittee all the time just to try and make them better, more fit for purpose. So formative assessment is not optional assessment. Formative assessment is to help you with the learning. So it's to provide feedback and to guide your learning. So for formative assessment, we have the direct observation of practical professional skills, the DOPS, and we have an oral presentation assessment. One of those is formative, and the professional qualities assessment. And the idea here is not a pass-fail. The idea here is to provide an opportunity for structured feedback. So when you do your formative oral presentation assessment, you are being marked by a couple of people, but it's not about passing and failing. It's about giving you guidance on what you did well, what you could do better, and helping you to improve. So summative assessments, we want those also to be used to help you gain confidence and gain experience in doing those things. But these are a pass-fail. So you have to pass 2 oral presentation assessments, you have to pass workplace reports. They're all summative assessments. So what do we have? We test your writing skills. So the learning contract report is a little bit about that, but the focus for the writing skills is really on the workplace reports and the research project, and I'll talk more about that in a minute, and the professional qualities reflection. And then direct observation of performance, obviously the oral presentation assessment and the DOPS, and then we have the oral exam at the end of training, which again is a sort of an assessment of how you think on your feet and how you can structure your ideas, but more about the exam at the end, a bit later. So the DOPS, This is a formative assessment. It's not a pass-fail. You have to do 3 over the course of your training. And it's getting a senior person, can be your supervisor, it can be another fellow, senior public health practitioner, to watch you, just to observe you as you do these activities. And as I said, the focus is, it's a formative assessment, the focus is on building your skills and building your confidence and building your experience in these types of things. There are a whole range of possible things you can do for the DOPS. These are some of them. The professional qualities reflection, for all of these, as we bring them in, we're building up to the equivalent of 1 a year. So this is 2 over the course of training, but in 2019 will be 3 over the course of training. That's not to increase the burden, it's to get around the college policy that when something comes in, it applies to everybody in that year group. So when the PQR came in 2017, if we had said, or 2016, if we had said in 2016 that you need to have 3, then even the people in their final year of training in 2016 would have had to have 3. So instead of doing that, in 2016 you had to have 1, in 2017-18 you need to have 2, and in 2019 you'll need to have 3. So it's just a way of rolling into that equivalent of one a year. So it's up to the trainee to identify an event or something that's happened in their workplace. You can see here difficult situations, interacted with colleagues, and to reflect, to have a think about what happened, why it happened. There's a lot of guidance on the PQR form to guide you through the sorts of things that you should think about and reflect upon and write up, and then discuss with your supervisor, so that you can sort of, reflections, I don't know how much people have used reflection. It's a really useful way of unpicking some of the parameters around an event that happened or events that are happening, to get a better, more sort of insightful understanding of those things and how they might have been different, whether you handled them well, you could have handled them better, and an opportunity to have that discussion with the supervisor. So the supervisor has to have the discussion with the trainee and just encourage them to give a critical reflection on that event. So oral presentation assessment, 1 formative and 2 summative over the course of training. What we recommend is that you do your formative in year 1, sort of makes sense, where you have a practice, you get some training, and then you do a summative in each of years 2 and 3. You can use the form for as many formative assessments as you want, just to get some structured feedback. You can do as many oral presentation assessments as you want, but you only need to do two summative ones. The presentation should be at least 10 minutes duration with question time, and we have this Jerry Murphy competition which all trainees should participate in at the local level, where you do a presentation and then 1 person is selected from each region to go forward to the national Jerry Murphy competition. So the oral presentation assessment can be used for the local presentation, but not at the national final. And the reason for that is that at the local presentation, it's most often the sort of first going in, giving the presentation as you would give it, whereas by the time you get to the national final, there's often been lots of input from a number of people to change and finesse that, that presentation. And we prefer to therefore just keep the oral presentation assessment at the regional level, but not at the national final. And you need to have completed at least 1 formative and 1 summative with a pass before you're eligible to sit the oral exam. So the role of the trainee is to identify the opportunities to present, although your supervisor might also say, why don't you use this for an oral presentation assessment. It's up to the trainee to arrange for appropriate assessors, and this can be a little bit complicated because for a summative assessment, you need to have 2 fellows who mustn't be the supervisor. That can be really tricky, and if you're really struggling, you can have a fellow who listens by video conference or teleconference, or if you really can't get 2 fellows to do it, then you can prospectively ask the Faculty Education Committee if you can have a senior public health person who's not a fellow to supervise you. Make sure you're familiar with the marking form, and make sure that the assessors have got, it's up to you to make sure that the assessors have got the appropriate marking forms. It's up to you to make sure that the assessors sign them off, which is something that's easy to do, is to fill them in and not sign them off. So all of that's up to you. And the supervisor just assists the trainee to identify opportunities and might provide some support for practice presentations. So workplace reports, and as I said before, it's an opportunity to assess your written work and sometimes some quantitative analysis skills. You need to do 3 over the period of training, so we recommend 1 a year. The college has introduced a requirement across all training programs, advanced training programs, for a research project. So how the faculty has dealt with that is that from 2017, one of the workplace reports has to satisfy the requirements of a research project. And so it's still, we're not putting an additional project onto trainees. There's still 3 pieces of writing, 2 of which will be in a workplace report, but 1 of which has to be in the format that satisfies the requirements for a research project. Now what we have had is we've had a few trainees who have sought recognition of prior learning for a research project that they've done in the past, and that's been approved. But we still want trainees over the course of training to write 3 major pieces of writing. So what will be from 2019, if you have had recognition of prior learning for the research project, then that doesn't mean that you only have to produce 2 pieces of writing. You actually are going to have to produce 3 workplace reports. And so when that comes in the 2019 handbook, that will apply to all trainees who are in the training program as of 2019. So even if you had recognition of prior learning in 2017 or 2018, come 2019, you will have to produce 3 pieces of writing, and whether they be workplace reports or research projects, there'll be a requirement for 3 reports basically. So the workplace report ideally is something that you do as part of your workplace. So you write up a report where you've taken a major role. So these are the sorts of things: an outbreak investigation, it might be a systematic review, it might be an evaluation of public health policy, but ideally it's something that you actually write for your workplace so that it's not an additional piece of work. There are requirements around the workplace reports. You've got to be sole author of at least 1 workplace report or the research project. 1 workplace report must contain quantitative data analysis and interpretation, and only 1 workplace report may be a published paper in a peer-reviewed journal, and the trainee has to be the first author if that's so. So 1 workplace report can cover off several of those. For example, it might be a published peer-reviewed paper that contains quantitative data analysis, and you cover off in 1 workplace report the last 2 dot points. So the role of the trainee, it's really good as you're writing your learning contracts to be thinking about what piece of work are you likely to be able to get a workplace report out of. So talk with the supervisor about the possibilities. You should be aiming for one workplace report for each year of training. That means that you don't get to the final year and you're suddenly having to write 3 workplace reports. So try and space them out and identify up front when you're doing your learning contract the sorts of projects that might lend themselves to a workplace report. It's really, really important that you're familiar with the workplace report marking guideline. This is your guide to what is suitable. The marking guideline is what the markers get. So you'll see if you look at it that it's got different sections. It's got an abstract, it's got an introduction, it's got a method section, it's got a results section. We think that workplace reports most workplace reports will be able to be marked according to that marking guideline, but that is what people mark against. So if you have something that you look at the marking guideline and you think, well, how is the marker possibly going to be able to mark my workplace report against that, then you need to think about whether that is an appropriate workplace report. It may be that you've done something for the workplace that perhaps doesn't have a method section. Then you might have to add a short method section. I mean, most things we do for the workplace, they have some sort of method to them. You think about, what do I need to do to respond to this, or to write this up, or to, understand what it is I've been asked to work on. So there will be some sort of method to it, even if it's not a standard sort of research project type method. So you must look at the workplace report marking guideline and see whether you think if you were marking it, you would be able to mark your workplace report according to that guideline. So the role of the supervisor: assist the trainee to identify suitable reports, supervise the writing, use your supervisors to get feedback, and the supervisor has to sign off on it to the faculty. But use your supervisors and use people around you, use other trainees if you can, to get some feedback on that workplace report, so that you only have to submit it once and it gets a pass, rather than having to go do a resubmission. These dates are in the handbook and they're on the faculty website. So there are 3 workplace submission rounds, one in March, which is right now, one in June and one in September. The assessment of eligibility to sit the exam is the 31st of July. And to sit the exam, you have to have passed 2 workplace reports. So if you submit one of those 2 that must be passed in the June round, there is a very good chance that you won't have a result by 31st of July. So because we have to takes time for the turnaround in the faculty office, it takes time for the markers to get their marks back. So if you are sitting the exam and you need to have 1 or 2 workplace reports completed by the 31st of July, then you should aim to have them submitted in that March round. So the exam's held in early November each year. So the oral exam, it's summative, you have to pass it. It's at or near the end of training. You have to have, I'll go into the eligibility requirements on the next slide. So it happens in Sydney. It only happens once a year. It's always right at the end of November, end of October, or the beginning of November. You have 45 minutes of reading and preparation time. There are 8 questions. So you need to prepare some sort of response to each of those 8 questions. The exam itself is 30 minutes with each of 2 separate panels, with a break between, which is around 15 minutes. But it is not exactly 15 minutes. Last year we had some misunderstanding of that. the key thing is that it's 30 minutes with 2 separate panels. And if it takes a few minutes to get started with a panel, then you might be late coming out, and then you might have less than 15 minutes. So there is a break between, but it could be 10 minutes or it could be 15 minutes, but don't imagine that it is exactly 15 minutes. So each panel is 3 examiners, and the content just covers key areas of public health that are in the advanced training curriculum. So you'll always get a plain language question, an Indigenous health question, and an epidemiology question, and then you could get anything that's in the curriculum. When I say plain language, what I mean is you will be asked to explain usually a fairly simple concept in plain language to a particular audience. So it's a little bit of a test of your understanding of the concept, although it's usually a fairly simple concept, but it's more a test of your ability to adjust your language to talk to different audiences. So in the exam, you're allowed to have 3 attempts, and you must complete it within the maximum training time, which I think is 7 years. So eligibility, all your learning contracts and learning contract reports have to be up to date. You must have maintained, or you must still have, current medical registration, at least 29 units of training by the 1st of December of the year of the exam, and by the 31st of July in the year of the exam, you must have completed 2 DOPS, 1 professional qualities reflection, that will be 2 in 2019, an oral presentation assessment, 1 formative and 1 summative, and 2 workplace reports with a pass, or 1 workplace report and 1 research project, except for recognition of prior learning. So 2 major pieces of work, of written work, that have been done while you've been in the training program, and of course paid the examination fee and current with college training fees. So a lot of this stuff we'll go over again for people who are sitting the exam. So I'll just go over it briefly. You have 8 questions. The pass is an overall score. So each question is marked from 0 to 10. A pass is an overall average across all questions of 6 or higher. But if you fail more than 2 questions, you fail the exam. The final result is a pass-fail. We don't give out any actual marks. If 2 of the 3 examiners give a score of 4 or less on a question, then that question is a fail. And an average score of 4 across the 3 examiners, 4 or less on any question, is a fail on that question. So, for example, if 1 examiner gives a 5 but the other 2 give a 3, then that question will be a fail because the average score will be less than 4. The outcomes are available 2 weeks after the conclusion of the oral exam, and the reason for that is to allow time for checking and to make sure that all of the entries are correct, all of the calculations are correct. The lead examiner needs time to prepare the feedback to the candidates, and just gives a little bit of breathing space to make sure we've got it all accurately. In 2018, we will still be offering the supplementary exam, and this is offered to candidates who receive an overall borderline score of between 5.8 and less than 6 in the main exam. And it consists of another 8 questions with 2 examiners, so just like a repeat of the main exam. And then the assessment is over 16 questions rather than those 8. So again, over 16 questions, an overall score of 6 or higher is required to pass it. It's treated as though it's not a separate exam, it's just an extension of the main exam. And the detail of how you'll be told whether or not you'll be offered a supplementary exam is being considered by the assessment subcommittee. We've tried a few different ways, and they're going to think about perhaps texting people rather than getting people to come back and get an envelope, but that's something that will be discussed with the trainees who are actually sitting the exam a bit later in the year. So for assessment for a summary in 2018, you need to have 3 written workplace reports or 1 research project and 2 workplace reports, 2 oral presentation assessments and the oral exam, 2 summative oral presentation assessments, and you have to have learning contract reports, a formative oral presentation assessment, 3 DOPs and 2 PQR over the course of the training. So that's all I have to tell you about the training program and about assessment. I'm very happy to answer questions. So if you type your questions, I'll just answer them so that everybody can hear.
So if you have any questions, please use the question and answer pane located next to the chat pane.
No questions? So Anthea's asked, are past questions from the oral exam available? There are questions from 2011 and I think 2012 are available. There are two years worth of questions available on the college website. I can't tell you exactly where. It might be, I think if you just search for them, you'll find them, but certainly 2011 and one other year, which I think 2012 is available, but not the answers, just the questions. There's quite a lot of support as you go, usually organised regionally for people who are sitting the exam. So typically what happens is groups of trainees get together who are sitting the exam and they write questions and practice questions together. And you should really get the fellows that are around and your supervisors will help in running practice sessions. And the exam, practice is just incredibly important because it really does test that skill of taking a question, sort of deconstructing what the question is asking, thinking about a structured way of responding to the question, and then being able to do that response. It's not completely off the cuff because you have this preparation time of 45 minutes, but that 45 minutes only gives you a couple of minutes per question to actually write some notes. So the practice is really important in getting you to organise your thoughts quickly, get them into a structure. So Belinda's asked, is it possible for the faculty to create a list of accredited training sites across Australia so we could plan our 3 years? Leah does have a list of accredited training sites. It's actually really easy to get accredited. So if you go to, if you get a training position in a site which is not accredited, it's a very easy matter to submit an accreditation form which is considered at the Faculty Education Committee, and then the position's accredited for 3 years. So, and we've had some really unusual positions that the position has been able to, the site has been able to make the case that this is a useful training position. So we had, I think, the medical director of Bupa. We've had somebody working in KPMG. So all sorts of slightly odd places as well as public health units. But if they're not accredited, but you can get a position which will allow you to cover off some of those competencies, it's usually very easy to get accreditation. But Leah will also be able to tell you what positions there are across Australia that are accredited. So Borgs has asked, are there any options for funding an overseas rotation or placement? So there are, the faculty, there is no funding for placements at all. You have to find your own. Position, which is not funded by the faculty. In New Zealand, the New Zealand College of Public Health Medicine training program has funded positions, but that's not so in Australia. So no, we've had trainees that have done overseas placements with places like Médecins Sans Frontières, but that is a post that is funded by MSF, and then the trainee seeks accreditation for that training site, and then has been able to do some training time within that position, but it's not funded by the faculty. Anybody else?
Well, it appears no one else has any more questions, and I think that concludes today's webinar. Thank you so much to Professor Robin Lucas for presenting.
If you have got any questions, please feel free to flick them to me in an email. I'm just robin.rybyn.lucas@anu.edu.au. Okay, thanks everybody.
Thank you.